Connaissance, recherche,
sciences,
sciences, mathématiques,
théorie,
physique, philosophie,
conférences,
archéologie,
nature.
So, since this is our last session before our general debate, I'd just like to take this opportunity to thank Esther Duflo and the Collège de France and the French Environment Agency for having organised this fantastic colloquium. I've learned a lot being here. I'd also like to thank the GPAL Europe teams, Elizabeth being the person heading up that. I'd like to thank them for all the work they've done as well to make sure this colloquium take place, and also Collège de France teams with the interpreters as well. I don't know how you managed to follow us step by step over the last 2 days. I would imagine you're pretty much on your knees. Thanks very much for the interpretation. And also the technical teams, Mr. Rodriguez, for example, who has covered all our travelling and spinning around into different geographical climes. So thanks very much to them. So, but before starting, I'd also like to apologise for the fact that my French has suffered because I speak in English now, at home, in my workplace. So I'm used to actually presenting this in English. So if I stumble over my words in French, then I apologise for that. Now, to make things easier for the English speakers in the room, I've tried to make bilingual slides. So if you speak English, look at the blue text, and if you're French, look at the black text. Now, what I would like to talk about now is strategies designed to improve impregnated mosquito nets in Kenya, in Sub-Saharan Africa. And I'd like to turn to 3 field experiments that I steered in Kenya over the last few years. And so the underlying question with regard to the dissemination of this mosquito nets, of course, is malaria. I don't need to talk too much about that because I would imagine you've all heard about malaria. It is an infectious disease which is transmitted from person to person through mosquito bites and kills 1 million people per year. People who die from malaria each year are generally kids below 5 or pregnant women, basically people who have got weakened immune systems, like pregnant women. And most of these people die in Sub-Saharan Africa, where people are suffering from malaria endemically or epidemically when the raining season sets in. So I'm going to be using ITN to describe this as concept, insecticide-treated net, ITN. And that's what it is, as its name suggests. But I'm talking about a new generation of ITNs, which are treated nets over the long term. So these nets remain efficacious throughout the entire life of the net. So what is it then? Well, here's a look at one. This is a rectangular one. You put it above your bed, or you can have a circular ITN. And this really protects you from mosquito bites. So why are these nets a solution for malaria? Well, quite simply because in the 1990s there was a certain amount of experiments, randomized controlled experiments performed by doctors in a number of African countries, and these tests showed that the regular use of nets made it possible to draw down significantly the number of malaria infection victims. And so it drew down infantile mortality to the tune of 20%, which was quite considerable. Now, if you look, however, at the number of people around the world, the number of people in the world who live in endemic malaria areas, results are quite low. So the information that we have recently stems from the World Malaria Report 2008, and this looked at the data stemming from 18 studies performed in 18 African countries, therefore, and this showed that in 2007, so very recently really, in 2007 only about a quarter of children and pregnant women slept under ITNs. So you can see that 3/4 of people need still to be covered. So that coverage rate, why is it so low, 25%? We know that these ITNs are effective, so why is it that we've never managed to get people to use these ITNs? Because, why don't they buy these things since they protect them? And after several months of racking my brains, I came to the following conclusion. The lack of coverage stems from the fact that there hasn't been any agreement in the international community about what is the best way to disseminate these ITNs. Now, if you look at doctors, there's a major debate prevailing about, should you give them or should you not give them? Some people say, Jeffrey Sachs is one of them. He was joined by the World Health Organization, and these people think that you need to hand out these ITNs free. The arguments, what are they? Well, demand for ITMs is very elastic. Is very price elastic. In other words, if you increase the price, then you're going to draw down demand, quite simply because people in malaria areas are poor and don't have access to credit. They can't borrow, so they don't have disposable revenue to pay for an ITM. Now, ITM costs quite expensive, like $6. I don't know what the exchange rate is, but about 4.5 euros, put it that way. And this is quite a sizable sum for a number of people who, on average, live about, if we want to use the World Bank metaphor, they live with, $1 a day. So the other argument for free handout is that ITNs is a positive externality. That's jargon as well. But what it means is that the greater the number of people covered by the ITNs, the less transmission will take place. In other words, if I'm protected by an ITN and I don't have malaria, if a mosquito bites me and doesn't bite you, even if I got malaria, you won't get it. So in other words, at least a huge number of people are covered. So if only 20% of population are covered, then mosquitoes can spin around the population, infecting people. But if you've got at least 50 or maybe 60% of people who are sleeping under ITNs, well then everybody's benefiting. Because what happens is that there are not enough people, if you like, who are infected, who are not protected by ITNs. And so the mosquitoes will disappear. That's just very simple, but that's the underlying idea about the positive externality jargon that you could have read on the slide. Now, on the other side of the equation, you've got people who are part of international organisations that want to talk about social marketing, and they say that you shouldn't give things out free. And their argument is the following: when people have to pay for something, well, they've got to ask themselves, do I really want to spend money for that? In other words, they're not going to spend the money if they don't think they're going to be using the product they've bought, or they don't see any point in using or buying the product. So you're not going to give ITNs to people who are not going to use them, obviously. So if you've got just a small sum, maybe you would discourage people who would not want to use the ITN anyway. So it's just a waste. We can also imagine a psychological factor with prices. In other words, if you pay for something, well, you're paying quite a lot compared with your revenues. This could be costly for you psychologically, and so you won't want to use the product. And let's imagine that you buy a 200 euro pair of shoes. If you never use them, well, then you'll say to yourself, oh goodness, I spent $200 or 200 euros and I haven't used them. But if it's just 20 euro shoes, then you say to yourself, well, I can wear them down to the ground because I didn't lay out much cash in the first place. So with this psychological impediment, maybe that kind of stumbling block could be a reason why people should be paying just a little bit to pay for to have the ITN. So these two arguments are in the debate, and so in other words, if you buy something, then you should be seeing that ITNs are used much more. Now, as I said earlier on, that because of this lack of agreement or consensus in the international community with regard to the price tag for these ITNs, there's been that's the reason why there hasn't been dissemination of ITN. Now, I worked with Jessica Cohen, who works at the Brookings Institution in Washington, D.C., and what we wanted to do is to answer the following questions. Now, who's right? Should you have ITNs that are free, or should you pay for them? Particularly, to pick up on that question, it was important to gauge two parameters. The first, you had to measure the sensitivity of people to prices, the price elasticity, and we have to see to what degree the price will actually change the usage rate of those people who have got the ITN. So we worked with prenatal dispensaries in a rural area of Kenya, in the west of Kenya, to be more precise, and we used the methods that you have heard a lot over the last 2 days, the randomized approach. Basically, so from a random perspective, we decided, okay, what clinic, what dispensary should be handing out ITNs free, and then see what happens, for women coming for prenatal tests, and then which dispensary should be asking people to pay for this ITN. And if this price, there's a small price, a medium price, and a higher price for paying for these ITNs to test the price elasticity. And then we compare the number of purchases in the dispensaries based on the price and the usage of the ITN once it was bought. So what are the findings? Well, we saw very straightforwardly that lesson number one in the economy is demand falls when prices increase, which is exactly what you see here. If you give ITNs free, well, look at the number of ITNs that are handed out, and it's much higher than if you ask people to pay, even if it's a low price. 40 Kenyan shillings, that equates to about 60 cents of a dollar. It's 50 cents of a euro, pretty much around there. So what you can see is that the number of purchases doesn't significantly fall when you go from a price from 0 to 10. So it's not an aversion to pay. It just means that it's a question of a budgetary constraint, really, of disposable income. So when you rank up the price, less people are going to buy the ITN. But the likelihood of people of using the ITN properly is the same regardless of the price paid. So 2 months following the purchase, you can see that on average 60% of people are using the ITN, and you can break down the data pretty much anyway. Whatever the subset of the population we're looking at, there's no price effect on the likelihood of using the ITN. Now, if you think that these bars are a bit different among themselves, well, it means you can't really distinguish whether they're the same from a statistical point of view. From a statistical point of view, what you can see here simply means that the usage is not determined by price. So, just to provide a synopsis of those findings, of that first round of experiments, the number of ITNs acquired drops significantly when the price increases. Among those that got the ITN, the use of the ITN is not affected by the price paid. In other words, if you multiply the result number one by result number two, what you find is that there are more people who are going to sleep under an ITN if these latter had been handed out free than if the ITNs had to be bought. Now, given that, if you hand out the ITNs free, then you get a coverage rate of about 60%, which generates this great positive effect over the population as a whole, because it generates, if you like, a massive drawdown in the transmission of malaria. So, by way of conclusion, with Jessica Cohen by my side, we think, well, quite clearly, it's more effective in terms of number of lives that can be saved. It's more effective to hand out ITNs free than to sell them, even if you sell them at a tiny price. And in order to have these extra lives saved, it doesn't cost very much, because in any case, even the programs that sell ITNs in Africa to pregnant women, these are subsidized. In other words, instead of paying $6, they get people to pay $50 centimes of a dollar. So $5.50 worth of subsidies there. So if you go to $5.5 of subsidy to $6, then that doesn't make much from the point of view of the people that are sponsoring this financially, but it makes a huge difference when you think about the number of people whose lives are going to be saved. So the second experiment was built on the results of the first one, and the underpinning idea here was, is there something we can do to increase take-up when ITN is not free? Because the findings of the first experiment showed that demand is very sensitive to price. So can we try and get rid of this this elasticity? Can we get this demand curve, which was very, how can I put it, says the speaker, very, very sharp, a sharp inclination to a gentle tail off? And so if we can look at marketing literature, done by private corporations that tries to sell us, I don't know, anything, toilet paper to shampoo. They look at the desire to pay in a very specific way. They look at what they brought to the fore, a practice that works well, which is contextualization. In other words, it can be very effective to frighten people, to say, look, if you don't buy this product, well, it'll be terrible for you in your life. Or, on contrario, you could say, okay, you want to give them hope. In other words, if you invest in this product, then your life will change radically and you'll have a great time. So the second marketing tip, if you like, is verbal commitment. In other words, to get people in advance to commit to investing in a given product. So these are two things, if you will, that I tried out in an experiment in Kenya, and this was implemented in conjunction with the Balu shops, with the CFW shops. These are franchised rural shops that Liz Kimbo headed up in those way back then. So this was an experiment which this time encompassed 1,289 households, and here we knocked on people's doors, and we did a brief interview with people, and then we gave them a voucher to buy an ITN. Now, this voucher was valid 2 months. In other words, the household had 2 months to go off to a CFW shop and exchange their voucher for an ITN. To do that, however, they had to pay a price which was randomly set and varied really from one individual to another. So from one household, they had to pay nothing. In other words, the ITN was free. In others, they had to pay, in other households, they had to pay, $4? Or $3 or $2. Well, there's a whole array of different prices. But suffice it to say that the price is the first level of randomization. It was the first thing that was a variable randomly. And then in order to estimate this contextualization and the verbal commitment dimension, I also randomized that. And so at the end of the day, I randomized the sex, the gender of the beneficiary, because I said to myself, okay, maybe women and men don't have the same, or don't respond in the same way to that marketing technique, and maybe it would be interesting to look at whether you could change price elasticity with regard to men and women. So I talked about randomization. The first level, of course, is price, and that varied from 0 to 300 Kenyan shillings, 3.3 euros, $4.6. Then the second level of randomization was framing. So there were 3 groups here. A third of the households were allocated a group randomly, and then we brought to the fore the burden of mortality and morbidity when they actually reached the time voucher. So they said to them, okay, this is the voucher for having an ITN. You know, an ITN is there to stop malaria. So in your household, have you fallen victim to a malaria attack? And if yes, well, does this bring about the death of your child? I mean, it's a bit difficult for households, obviously, and also for the investigating staff to do this, to ask people to cast their minds back in their own painful history, maybe, thinking about malaria over the last few years, talking about their own families, or among their friends or their neighbours, to try and make something very palpable. This make something very tangible. The horrors of malaria, and to test to see whether, well, would this encourage people to invest more in an ITN? Now, the second group was more positive. Like, rather than talking about the horrors of malaria, morbidity and mortality stemming from malaria, in this case, actually wanted to encourage them to see an ITN investment as being an investment which was profitable from a financial point of view. So we asked them to do the exercise, if you like, to compute the number of Kenyan shillings that they would spend every year to combat malaria as it struck their family. And what they spent in medical care or taking family members to a hospital, and to compare that to the price they would have to pay for the ITN. So that was the positive version, if you will, of the contextualization or the framing. And the third group was a control group with no framing at all. Now, the third level of randomization, some households, well, half of them in fact, well, we asked them to commit verbally. We asked them, we said, okay, do you intend to use this voucher? So here's the voucher, and then you say to them, well, look, are you going to use it? Are you going to go to the shop? Are you going to buy this ITN? And then we found that everybody said yes. Pretty much, 99% of people, 92% of people said yes. And to give them, and make sure that they were committed to us, we said to them, well, when are you going to go then? Well, in a week, or in a fortnight, in a month and a half? How much is that the necessary time to save enough money to buy the ITN? And who's going to be actually sleeping under the ITN? Is it for you? Is it for your son? Is it for your daughter? Or is it for your grandmum? So we really tried to make sure that people really took on board their decision here and now in front of us. Were they going to invest in the ITN or not? And the underlying idea, the idea lingering in the back of our heads, was the following: this auto-perception theory and this foot in the door marketing theory, foot in the door theory, which is to say that once you force people to make a decision like that, to commit in front of you, because they've committed, because they know it's good for them to have this ITN, well, that kind of generates a perception of themselves which is positive, and they don't want to necessarily disappoint you tomorrow, the following day, or the week later, about the behaviour that they committed to adopt. Now, the fourth level of randomization was who in the household who received the voucher, and who was who actually was involved in the verbal commitment or the framing. Was it the wife or the husband, or was it both? And the findings: no difference, nothing matters except the price. So basically, the idea was, look, can we make the demand curve a little less sharp? And the idea is no. The demand curve remains sharp, and there's nothing you can do to change that. So just to convince you of this, I'll show you one or two graphs. This is the demand curve. So compared with the previous experiment that was with the clinics, the prenatal clinics, the range, the speaker is looking for the word in French, the range of price, the price range was much broader. So I don't know whether you remember, but it was 40 was the maximum price in the prenatal clinics. 40 here, if you like, for 40 shillings, there's 75% of people would buy an ITN, which is much higher, therefore, than in prenatal clinics. And this is because people had 3 months to save up for the ITN and then exchange their voucher, whereas in the prenatal clinics, well, it was immediately you had to buy the ITN. So you can see here that it's less sharp, this curve, than before, but simply because people had more time. But if you look, the price, 200 or 300 shillings, it's much lower than the price, than the cost of manufacturing an ITN. So that's a subsidised price tag there, and only 10% of people are buying the ITN. So what's interesting about this graph is that whatever the marketing pitch, whatever the framing, if you like, whether it's the cost, mortality, or the financial side of things, that doesn't change anything. The curve is exactly the same, and the grey zone tells you can't distinguish these things among themselves. So basically nothing changes, right? So verbal commitment, even though that 92% people said, or 95% said, okay, I will be doing this, I will be buying it, it didn't change anything. 35% of the test group that had to commit bought the ITN, as to 37% of the group that didn't make that commitment, or at least weren't asked to take out a commitment. And so that's not a very significant difference, is it? 2% from a statistical or economic point of view. And then the third point, be it the man or woman who received the voucher, or the framing approach, that didn't change anything either. What was marginally interesting was that if you give the reduction voucher to the man or woman at the same time, it would seem that increases the investment rate in the ITN. But basically, that change is very weak. And when you compare, particularly when you compare to the price, I mean, it's by no means a change which is meaningful. So if you want to ramp up investment in ITN, rather than to find the two people at the same time to give them the voucher, because that's always a bit tricky, it's better to reduce the price by 1 shilling, they say. Anyway, okay, you can say, oh, that's all very pretty, but the demand curve hasn't changed. And maybe, in the various interventions you made, maybe what could change, maybe, is the usage rate. So maybe people that we talk to about mortality linked to malaria are more likely to hang up their ITN and use it properly. than those with whom we didn't talk about mortality. But apparently, no, nothing either affects the usage rate. It's exactly flat. It's about 60%, as in the other experiment, 2 months after when the purchase was made. But it's flat, nothing's changed. And we also looked at whether it changed depending on who slept underneath the net. Maybe people had their children sleep under the ITN, and if you talked about mortality, maybe parents are more likely to put their kids under the net, but that didn't happen either. So by way of summary, the summary of the findings of experiments 1 and 2, it would seem that demand for mosquito nets in Kenya is sensitive to price, but insensitive to the other variables that were tested. And so nothing works, basically. And the same conclusion with regard to free handouts. Those are more effective and more profitable than sales, if you like. More advantageous than selling the ITNs. But then the following question is, what long term? So it's all very pretty, that. Handing out ITNs free to everybody, what does that mean for the long term? Does that mean that people aren't going to just get used to having free handouts, and so then it will be impossible in the future to get them to pay for anything, for an ITN for the long term, or even other health products, education products? Maybe people will say, well, look, hang on, there's no point in buying them because I'll just wait for the government to turn up or an NGO to turn up and knock on my door and give it to me free. So there are two reasons why we might think that would happen. We can imagine that people would really think about the price that they paid in the past, or for those who didn't actually receive the voucher and didn't receive an ITN free. I mean, most governments that decide to hand out ITNs free today, at least, do it only for pregnant women, not for everybody in the entire population. So we can imagine that people who don't receive an ITN free say to themselves, well, why am I going to bother buying one? I'll just wait until a neighbour who's pregnant, and then she'll give it to me. So well, I mean, those aren't standard effects, if you like, that economic theory would say, because economic theory says quite the opposite, actually. It says that, people, once they've got an opportunity to use an ITN, and they've received it free, let's say, they know to what extent that object is good, advantageous, and so they can see before their eyes firsthand the advantages, and that learning curve of seeing the effectiveness of an ITN can only reinforce their desire to invest in a future ITN. Another standard effect, according to economic theory, is that if I learn that these ITNs are great, then there's no reason why I wouldn't share that information with my neighbour. So, okay, I'm a pregnant woman, I get an ITN free, and then I'm really pleased because it works very well. Then I'll tell my neighbour, look, this is really brilliant, this ITN, and then they're going to go out and buy one. So it's this social grapevine, if you like, should spread the penetration rate of ITNs if you have a small hub of people that are benefiting from the ITNs. So the first round of experiments to see, well, is that true? This anchoring effect, if I can put it that way, and this low price thing prevails, or is it this grapevine effect that prevails? So to pick up on that question, I did something which was quite mixed up with experiment 2 that I've just covered, which uses exactly the same modus operandi, knocking on people's doors, offering vouchers that were valid for 3 months, changing the price, obviously, from one household to the next. And then what's interesting there is that there are some villages where nobody received a voucher for a free ITN, and other villages where people received a voucher for a free ITN. So basically, we wanted to do see whether in one village where there's a free handout, does that give this deleterious effect where people don't actually want to put their hands in their pocket to pay for their own ITN. And the other thing that we want to look at is that a year down the road, a year after doing the first experiment, when people received the first voucher and the first reaction voucher that varied, you remember, depending on the price, a year later, there was another voucher offered, 150 shillings voucher as a fixed price offered to everybody, about €1.60. So the results of that, now as earlier on, this doesn't change. Demand drops very quickly, tails off very quickly in conjunction with the price. But something I want to look at is that these people, they have to pay 40 to 50 shillings. The reason why they don't want to, there's no higher rate of investment than that. Does that stem from the fact that they've seen those people who got the ITN free, and so they say to themselves, well, why should I pay? Why should I pay 40 shillings? And they don't pay. So to test that, we can look at if the households that have to face a 40 shilling price tag, but they've got nobody around them who received an ITN free, because nobody received the voucher for that article free. If we look at those people, are those people more or less likely to invest in an ITN than those people who got an ITN for the same price, but around them had people who received an ITN free? So it's to test that hypothesis according to which people are jealous. So when I tested that hypothesis, I found no proof, no evidence of jealousy at all. But I mean, that's the regression. An econometric regression. In other words, I look at the probability that you'll buy your first ITN as dependent upon the fact that you've received the maximum subsidy. Right. So the fact it's negative, the fact that there's these stars here, you've understood those stars. That stars mean it's really important. The figure. This simply means that there's another effect going in the opposite direction. In other words, for a given price, people are less likely to buy the ITN. I mean, there's no jealousy effect. If they got the best price in the area, then they're saying, "Oh, nobody else has got this free, so I'm not going to tell my neighbours that this is really good, so I'll buy it and I won't tell them." So what we can look now is drill down to look what people say, to see whether there is this kind of grapevine effect, social grapevine effect. Does this help having people around you that are actually getting an ITN less expensively? Because then you say to yourself, "Oh, this is really worth it." So I asked people whether they knew people around them who had used their voucher, and on average, people knew 0.7 people who had used their voucher. And I asked them then, had that person talked about the use of their ITN, and 38% said yes, and out of those, did they recommend you to get one? 73% yes, 27% no recommendation. But what's interesting is that nobody didn't say don't buy this. So when there was an advice given, it was designed to say to somebody, look, go out and buy this. So people are saying, okay, they've learned something from their neighbour, and now we can look in the finer detail to see whether there was a social learning here, a social grapevine. So to do that, what I did was that I looked at the fact that because I varied the price randomly, it so happens that in some households which have to pay, say, 100 Kenyan shilling price tag for their ITN, suddenly they find lots of neighbours around them that receive an ITN free, and as others found themselves with no neighbour having an ITN free. So the density of people who received an ITN for a given price varies randomly, because given the fact that the price was set randomly. And that enables me, it's a bit technical, sorry about this, but this enables me to look at whether more people around you that have got an ITN free, it's more likely that you will invest in an ITN. And so, again, lots of stars here. This is pretty good. The positive effect here. And this means, basically, that you're more likely to buy the ITN if there's a higher percentage around you of people who have got the ITN, so with the maximum subsidy. So that means, if I learn from my neighbour, my neighbour gets the ITN free, and that helps me, actually, understand the value of the ITN, and that encourages me to invest, even if I have to pay a lot of money myself out of my own pocket. So that's the social grapevine effect.
Now, what are the effects of individual learning? Those people who received a net for free in 2007 or had this voucher that could redeem for a free net, when you go and see them in 2008 and say, would you like to buy a second one, are they discouraged by the idea they have to pay for it because they thought they might get them for free again, or because they learned that the net was efficient, they would agree to buy one? So, by and large, the idea is to see whether experience dominates or is dominated by the price effect. So to see if there is an experience effect, the first thing we need to check is whether people use the net or not. So as I showed, 60% people would use the net after a month, and 90% of them would use the net after a year, whatever the price they had to pay for it. So even when they get mosquito net for free, they can experiment with the net, but they could learn that the net is totally useless. So the second thing that you need to look for these people is that they've been using this net, they got it for free, and it had a beneficial impact on their health. So you need to see if people have declared malaria in the month after the study. And we see that people who got a free net in 2007 are less likely to contract a disease than those who did not get a net for free. So there is a decrease in the number of yellow fever episodes. So when people use this net and realize that there is a decrease in the morbidity level, they realized then that the net is efficient. When we ask people if they think the net is good, they say yes, it's far better than any other net they ever had before, which was not impregnated with chemical products and was not as efficient. And no one answers that the net is not good. If you ask people how much they're willing to pay for this net, the first year I asked them, and they would answer 100 shillings on average. The second year, once they'd been using the mosquito net, this price bracket increased considerably, especially for those who had received one for free. They claimed they're willing to pay more than 150 shillings now. So all this is very nice. This is what people say. So I've been carrying experiments for 3 years in Kenya on mosquito nets. So maybe they think, okay, this girl, she likes nets. So when she comes and asks, we'll say, okay, we're willing to pay. But I needed to check that. So to check that, I needed to see if people had used their second voucher, which meant that everybody had to pay 150 shillings. And those who received the first net for free, or 5 percentage points more likely to buy the second net than those who never got any net for free. So the impact is all the more impressive when these people already have a net at home, when the second group don't, because far less of them have. So having 2 mosquito nets is fine, but it is not as powerful as having 2 times 1 mosquito net. So we could anticipate that these people having 1 net already are not as willing to buy a second net than these ones. And in fact they do. So it means that they learn something about the nets. And there again, the impact is quite important. 6 percentage point means 42% altogether. So there again, you could say, okay, but this has nothing to do with the learning curve. It's just because people, they received a net for free, so they were less likely to suffer yellow fever. They work more, they generate more income, so they have more money, and it's easier for them to buy a mosquito net. So from a political standpoint, it's no use knowing whether it's a learning curve type of effect or if it's an income effect, that's for sure. But from an academic standpoint, we need to know about it. So to test that, I gave them a voucher for another type of product, and a product that never experimented. There'd been no previous experience, whether in one group or the other. And this was a voucher for a water treatment product. And those people who had received the mosquito net for free on the first year were more likely to buy the water treatment or water decontamination products. So there is an income effect. People have more money and now can invest in water. But this is a 16% effect versus 42% for the nets. So it shows that the learning curve impact is also involved. So when you give something for free to people, these people learn about the net, and that generates an income effect that helps them invest in other health products. So in conclusion, the free distribution of mosquito net seems the most efficient way to increase the coverage rate for the most vulnerable populations. And so far in my research, I've not yet identified any evidence showing that there is a problem with regards to free distribution, because people tend to use it as much, whether they get it for free or whether they've had to pay for it, and they're not used to being given the net. Yet, this is just a very small part of the work, and I still have a lot of work ahead of me, and there are many issues that need to be sorted out before we can start distributing nets for free everywhere. Why? Because on the large scale, it's going to be far more difficult to implement a program like the one I implemented in Kenya, because I could check that clinics were observing the experimental setup, etc. But on a large scale, if it's organized at government level, there will be significant corruption problems, and half mosquito nets of pregnant women will end up in Uganda, sold by doctors supposed to distribute those for free. Another question is that Kenya is a very specific context. For many, many years, and before these experiments, there had been various campaigns organized by the government, but also by a marketing organization, which had organized many information campaigns around mosquito nets. So people knew things about mosquito nets, and I don't know exactly what would happen if we were to distribute mosquito nets where people had never been informed beforehand and they know nothing about yellow fever and those diseases. And in those countries, I guess we should also implement information campaigns, but this is something I can't talk about because in the context in which I carried out these studies, information was already available. So I'll stop now and hand over to Liz Kimbo. Thank you.
2 days. So I wanted to just sort of round up the context in which these studies have taken place first by commenting on the Kenya context. And as Pascaline just finished off by saying that in Kenya, there has been a heavy investment in malaria awareness and behavior change programs. Investment has been made by the DFID, by USAID, UNICEF, several partners. In fact, just in the last year or two, there has been a dramatic increase in the number of children under 5 who are sleeping under an ITN, with numbers reaching 67% in 2006, 2007. This is a lot attributed to the distribution of free nets through the Global Fund for AIDS and TB and Malaria, 3.4 million nets and additional nets through UNICEF. And in fact, Kenya's current policy today is that it supports free distribution of ITNs, and that this is not just targeted to the vulnerable groups. It's not just for pregnant women and for children under 5, but for all of the communities. Last comment I'd like to make as far as Kenya is concerned is that there are actually quite differing usage and acceptance of bednets between the different regions, between Western Kenya, where Pascaline has done a lot of her work, and in other areas, like in the Coast Province, which tends to be at a lower altitude at sea level, where it is very hot and very humid, and work there has been, quite a lot challenging in this area. I'll talk a little bit about our experiences in other areas with CFW Shops. The CFW Shops are a private sector, non-governmental organization. We worked with nurses and community health workers in what must be now over 25 districts in the country. We started out in Central Province and have outlets in Western and Nyanza provinces, that's in the western part of Kenya. The characteristic of these outlets is that they're franchised units. And the organization, Sustainable Healthcare, recruits nurses who then set up their own outlets and that provide basic services to the community. These outlets charge for their services. They charge for consultation and they charge for the products that are provided. So it's treatment, and in the case of malaria, they will provide diagnosis and charge for it. They will provide the medication. Yeah, right now with the new drug that has been provided, Coartem, there's no charge for that. But before, we would charge for even the anti-malarial drugs. And we do provide subsidized bednets through an organization called PSI that has done a lot of distribution of bednets in the country. And those prices will range, and we have the pictures that Pascaline showed earlier. We have the full range from conical, white, blue, green nets. Now, we ran a special promotion for the lowest cost nets in 2006. And, I will confirm that definitely there's a very, very big difference that we saw once we varied the prices of those nets. As you will see here, as I mentioned, we had sort of been going along just selling a few nets. Note that there's a lot of other net distribution programs also running in the country at that time. But we did go from average sales in a month of just 2,000 nets across, about 60 outlets to over 20,000 ITNs sold just within 1 month, 2 months, with a price reduction of $1.50 to about 66 cents of the US dollar. The uptake was huge. In fact, we could not meet demand. And in the first month of running this promotion, all the nets were being used within the households that we were selling them to. But when we continued that promotion for another month, we started to find that there was leakage of the nets, that now the nets were leaving our immediate areas where the outlets were and were finding their way into the main markets, into the main towns for resale. Yeah, so people, of course, had seen this commercial opportunity to buy the promotion nets, and maybe because they had nets already, they could go and make a buck, literally, in the nearest town. And we actually stopped that promotion due to this leakage issues. And I just wanted to bring that out because later on, as we're talking about effects of scale-up, this is definitely a very big problem that we need to look at. How do you work around issues of corruption and issues of leakage outside of the target groups or outside of, shall we say, vulnerable groups? But I would like to say that with the CFW shop outlets, the aim is to reach everybody in the community. The aim is just to provide the services and to provide the products to everyone, which is very different from the targeted programs that you have within the public sector. In our case, the nets were just there, and for us, it was just about getting as many people within the community to take up the bed nets and to actually use them. I also want to talk a little bit about Netmark, which is a program run by AED and funded by the USAID. And the goal for Netmark, which is, there's 2 very large bednet programs in Africa, and generally they're either run by PSI or they're run by Netmark. But there's a difference in the way that the 2 programs are run. And while both of them have a goal to reduce the burden of malaria, with Netmark works a lot with commercial entities, and we do targeted subsidy programs. A lot of it is by providing discount vouchers to households, but also now with free distribution. Netmark is especially concerned about proper targeting, that the product gets to the people that are most needy. I will not go deeply into the research, but you can find all the research that I mentioned here on that website, netmarkafrica.org research. And what Netmark has been doing is they've been doing household surveys in these countries for now close to 8 years. And they have been taking the same households and looked at them as other various bednet programs have been run around those households. And I think the results are very interesting for anybody here who wants to take this up and learn more about ITN's distribution. One of the things, these are some results that Netmark has concluded, is that after running the information, education, and communication campaigns in most of these countries, that ITN awareness has become near universal. And I would definitely say that has been the case in Kenya, where programs have been run, as I said, since now for more than 10 years. However, in Nigeria and Ghana, it was found that nets that were paid for were slightly more likely to be used than nets that were given out for free. So 62% of nets for which something was paid, didn't matter what it was, because there's different voucher programs. So 62% where something at least was paid were used the prior night, compared to 57% of nets that were obtained for free. And as I said, you can look at the detailed research or get in touch with me. Interestingly, in Nigeria, over the period of time from 2004 to 2008, when net ownership did double, but there was no increase in the under 5s that were protected by a bednet. In fact, they found that a lot of the nets that were given out under voucher programs and even under those that were given out for free, that 44% were not used at all. Yeah, over 16% or so were still in the packaging that they were given, yeah, sitting under beds, and others had been removed from the packages but had just never been hung. Yeah, and there's very many different reasons for these. That probably there's a lot more research that needs to be done to look into these areas. I also want to comment a little bit about socioeconomic status and these comments about what people say as to why they do not own a net in communities and areas where a lot of nets have been distributed. Where Netmark has found in Nigeria, and figures about the same in Ghana, that 42% said that the nets were too expensive. Even where, again, there's different voucher programs to reduce this, but that not only did they say that it was too expensive, that was the reason why they didn't have a net, but this did not really change between the low socioeconomic status groups and the high socioeconomic status groups. And one of the comments from the Netmark researchers was that generally in a lot of these communities, it has now been found to be socially acceptable to say, I couldn't afford it. And so that is the reason that is given by a lot of communities as to why did you not buy a net. And out of the various things that we have looked at, I just thought of, there's a number of things that keep coming up, as Pascaline talked about as she ended her presentation. I wonder about the whole effect of IEC campaigns or behavior change campaigns in communities before the distribution of bednets into those communities. We have seen in cases like Kenya where there has been a lot of communication and a lot of awareness that you put nets into the community and there is great demand for them. Not only is there great demand, but that there's a high level of usage, but we're not seeing that universally across other areas. We have seen, for example, the Nigeria example, but we have also seen in Ethiopia where net usage has been very low despite free distribution. There has been, in Ethiopia in the last few years, over 20 million bed nets have been distributed, which is sufficient to cover just about every household. But there we've got, yet to be published results that the actual usage is very, very low. And there is need to look at what amount of information or what level of awareness and education do you need in the community before you provide the free nets in order to have that assurance that the nets will be taken up and that they will be used. One of the other effects we saw from CFW shops is that a lot of the people who came to buy nets did already maybe have nets that they had received through other free distribution programs. I fully endorse and support this view that free trial, that education and free trial raises appreciation for the product and that people will come and take it up when you provide it and will be even willing to pay for it. I fully endorse that. But there's in all the communications that we see on bednets, we keep seeing this idea that bednets distributed can last for 3 or 4 years, 20 washes, and if you do 2 washes a year, then it will last. With the CFW shops, our experience was that some of the nets did not even last 6 months under the usual wear and tear of rural households. And I believe that there is need for studies to be done that take on, after a number of years, to really see the longevity of these benefits, and at which point will nets need to be replaced. But coming to this issue of replacement, coming from the private sector, as I do, there is then a concern that when you do the free distribution, there will be a need for those nets to be replaced. And if that has not been built into the free distribution campaigns, that you will still need to have some kind of retail sector, some kind of alternative. The market needs to be there and the providers need to be there where people can go in and buy the nets. And I am concerned that we have not yet started to look at what happens thereafter. So when I look at the commercial sector, yes, the manufacturers of bednets, really shouldn't have any reason to complain with free distribution. There's more nets. The market is only growing larger for nets. However, we do have to look at the effect on the retail sector. We have to look at the effect of what happens along the distribution chain that is outside of the core public sector that may be distributing these nets. Again, from outlets that are not within the public sector, I think the whole question about what are the subsidy levels. We just tested half price and we saw a big demand. But what exactly are the subsidy levels that may need to be retained even after free bednets have started to be distributed? And those are just my very basic comments as a follow-up to the excellent research that Pascaline has done. And now I just wanted to leave some thoughts and some questions in your mind coming out of this whole discussion on scaling up of bednets. Thank you very much.